The wait is finally over. You're packing your stuff and leaving the hospital bed. You just couldn't wait any longer. The doctor said your surgery was successful. You just want to get home and binge watch YouTube all day. While doing so, you start to notice that the ads look different. They are focused on health products, doctors, and physiotherapy clinics. You think that it is odd, considering you haven't searched anything related to it. You browse Amazon, the health products you might need are on the top of the homepage. You're watching YouTube and ads concerning your current health condition start to pop up. It almost seems that someone had access to your medical files. Well, it might be the case of medical data is some of the most important and some of the most secure data. Despite that, with the digital revolution that is in process in healthcare, an enormous amount of data is being generated. It is estimated that 30% of all data generated in the world corresponds to health data and records. They are not being put to good use, left to gather dust on cloud storages. Big tech want to change that, but blockchain technology might complicate things a little bit for them, as we explain in this video. What exactly is a blockchain? A blockchain is a collaborative ledger of transaction records that cannot be tampered with. Its name comes from the records being grouped in blocks, each which have a unique hash identifier. These are then connected and each as a hash of previous block. This structure allows modification of a block to be very difficult to hide since all other blocks will be modified as a result. So it makes a great place to store information you don't want to change. In order to add a new block to the blockchain, it is sent to every participant or node in the network to get validated. The nodes receive a reward for their work, usually in the form of cryptocurrencies. The block is then added, an updated form of the chain is sent throughout the network.
So, how exactly can blockchain be used in healthcare? Well, blockchain can be a vital asset to organize supply chains with authentic origins and prevent counterfeit prescription and devices from harming the unaware public. The entire prescription process from manufacturing to obtainment by a patient is made transparent using blockchain. At each step, verification of the current block can be done to preserve the security of the medication informations. For example, the pharmacy can review and validate if a medicine's manufacturing warehouse and shipping method was up to par, and if so, authorize it for patient use. Another area in healthcare that blockchain technology could enhance is contact tracing. Contact tracing is a key strategy used by health officials during pandemic to help slow the spread of diseases. Upon diagnosis, contact tracers will direct people to service that can be help them deal with the disease and isolate properly in order to prevent further spreading. In addition, anyone that has been in close contact with the person diagnosed will be notified about possible exposure and will be appropriately directed. Keep in mind that the name of the diagnosed individual is kept confidentially. Blockchain can be utilized in contact tracing by allowing the sharing of disease diagnosis between doctors and patients or doctors and other doctors. Features such as decentralization, delayed timestamps, and delayed location data helps to increase patients' privacy while continuing to effectively notify individuals of disease or diagnosis. But perhaps the most important area that blockchain could revolutionize is electronic medical records. Instead of hard copy record that can be potentially get into your wrong hands on or the transfer of records via email or mail, all the medical records are now online and encrypted. If the records need to be transferred to a different area of the hospital, switch between doctors or transfer to another hospital, setting up a unified electronic medical record. Blockchain could allow patients to securely own their data be verified by healthcare provider through query of the blockchain on whether the patient's locally stored encrypted information correctly corresponds to the encrypted information. On the blockchain, there is a very little risk in the information being intercepted by someone else due to the blockchain's encryption and privacy features. The security of the system is further enhanced by decentralization identifiers and self-sovereign identity. Decentralization identifiers allow for the verifiable but decentralized digital identity, while self-sovereign identity gives people control over their digital identities. All in the blockchain, technology can work to organize and protect confidentially patient information by allowing the patient to control their own data in self-sovereign identity ecosystem. This system is independent and does not rely on a single third party of validation. Rather, the data can be distributed in decentralized chains where the data is in multiple locations, preventing tampering and manipulating. Why do big tech companies wants to invest in the healthcare industry, and why now? Well, it is easy to understand when you know the healthcare is a $4.1 trillion industry waiting to be disrupted and consolidated. It is still full of inefficiency and waste, and the timing could be better after a pandemic that shocks its structure and increase in the demands for modern and digital solutions. A perfect prey for powerful companies with billions of dollars to be spent and with experience in disrupting other industries. While the idea is attractive, the reality is harsh. Big companies have already tried to innovate in healthcare, but a great number of failures followed. The modern solution was a series of acquisitions on the sector like Amazon, who just acquired the platform owned medical. The frustrating past attempts happened because the healthcare is so far more complex system with a deep rooted problem and a lot of stakeholders involved compared to other industries. Google Health is an example for that. In the last 2000, Google shut its shot at the electronic health record files by launching Google Health, a personal health platform, in 2011. It was interrupted due to numerous reasons like a lack of relationship with the health providers. Most important one and the center of this video tries to give you the magnitude of the importance of your health data. We have to remember all the entities which is use health data to operate, that includes health insurance companies, pharmaceutical industrial hospital, and the government. Imagine how it could impact the decisions of who get insurance, the price of drugs, and the health service in certain areas, and the loan deals. Apart from commercial use, health data can be used in the positive way as well. Through a big volume of data, we can enhance the quality of healthcare, study a variety of drug treatments, and cross-link this data with social determinants of health, which could impact how we implement preventative measures aiming at the healthier society.